What is causing this peak in COVID cases, and should it give ordinary people like us concern?
So let's deal with the first one, which is why have we got this rise in number of cases? Well, as normal activities have resumed, i.e. socializing, going out, meeting people, and on top of that, we have a variant of Omicron. This is often termed as BA.4 and BA.5. So by variants, for the benefit of our listeners and viewers, I would say slight change in shape. So with that slight change in shape, it finds it easier to infect people. And as it finds it easier to infect people, we have had this surge in number of cases.
Getting out and socialising more, because it is, I suppose, summer.
It is. And whilst our case numbers are rising, of course, they're not at the 2021 peak levels. And what we need to have is that watchfulness. So as you asked about, should we be concerned? Well, my answer is yes, we need to be watchful, because with the rising number of cases, there's always a lag period with hospital admissions, and then there is a lag period with deaths. At the moment, what is happening is that whilst the case numbers have gone up and hospitalizations have gone up and also ITU numbers have gone up, in other words, people needing respiratory support, it's not at the levels that we had in 2021. And why we are in a better place today is because the vaccines that we have been giving have been doing the protecting job of preventing severe disease. Obviously, it doesn't prevent infections, but it does look like it prevents severe disease.
So how worried should we be about this? How worried are you?
Well, it's watchfulness, because if it has gone up in summer, then what will happen in autumn is something to be very aware of and watchful of and to be prepared for. Now, my way forward would be as follows. So instead of sitting there saying, I'm worried, what can we do? Well, what can we do is keep our momentums up, which is protect the vulnerable people, protect key workers, protect essential workers, and all of them. At the moment, they can only be protected one way properly, which is the vaccine. At a higher level, I would say, have we reached the time now when we need to reformulate the vaccine that would be given out as boosters come autumn? So I'm veering towards, do we need a reformulated vaccine?
Are they working on that now?
I'm sure they are. And you see what it is, the vaccines were created with the Wuhan strain. And then after Wuhan, we had Alpha, Beta, Delta, Omicron, and now BA.4, BA.5 versions of Omicron. And so there is that little drift from the original Wuhan strain. So we now need to catch up and say, well, look, this is what is circulating in the majority. Let us give you immunity against this. When we give people immunity, we give immunity and it works across the board. In other words, it protects against Delta, Omicron, Alpha, Beta, etc. But the further away we keep on going, the less and less protection is possible.
So bottom line advice for everybody watching at the moment is when a vaccine becomes available to you, and boosters are available to those particularly vulnerable, but when one becomes available to your group, go get it, yes?
Absolutely, Anne, and that's spot on, because apart from the vaccines, we've got masks, ventilation, etc. Those are also good measures, but we know that the vaccines work, and when it is your turn, don't delay, do get it, especially if you are in the vulnerable group.
Welcome to the GB News YouTube channel. You can watch us live 24 hours a day, catch up on your favourite shows, and join in the conversation in the comments below.
Don't forget to subscribe and you'll never miss any of our exclusive content.